Senator Gazelka moves to amend House File Number 2402 as amended pursuant to Rule 45, adopted by the Senate May 7th, 2014 as follows. Page 90, and this is the A15 amendment.
Senator Gazelka.
Thank you, Madam President. Members, this amendment deals with electronic cigarettes. This Senate File 2027, as I stated in Section 1, it bans the use of e-cigarettes in public places. That means business owners would not be allowed to determine whether to allow adults to use e-cigarettes in their establishments. The problem with enacting Section 1 is that it would give Minnesotans the wrong impression that e-cigarettes are in effect the same as traditional cigarettes, because they would be both banned in public places. Members, we heard this in Commerce Committee, and there was a lot of dialogue related to this issue, and it's a contentious issue. Both sides of the aisle have people for it and against it, but I really don't think that we should be requiring the private sector to automatically not use these when we don't have all the data on them yet. We don't have the FDA ruling on this yet, what it's going to be like. Members, as we looked at it, I know the side that wanted to completely ban them made a number of arguments. One of them was that we don't know what's in them. And yet in committee, the opposing side actually handed out the real product, and you could look right on the label of all the things that were in it. They said that people don't use these to quit smoking, and yet I have heard of a number of people that use these. They say that it doesn't help, that it doesn't work, and yet if you put it in perspective, e-cigarettes, they contain nearly the same exact trace levels of nitrosamines, I think that's how you say that, as you'd find in the patches that people use, nicotine patches. But more importantly, there's 1,300 times less of that substance than, for example, you'd see in a Marlboro cigarette. So clearly, even if they're not quitting, it dramatically helps in their process of getting off of tobacco. There was also a study of businesses and asking them, how many people use e-cigarettes in your establishment, and a large number of them had no idea. And the reason why they had no idea is because it is not the same as smoking a cigarette. It's not the same. And so they didn't even know. A lot of times you don't even know if somebody next to you is doing it. So this amendment recognizes that, we don't want kids using them. It recognizes that as in the public, we can ban all state government buildings. We can do that. But it also says that we should not be doing that in local bars and restaurants. We should let them make the choice. So, Madam President, I would like a roll call on this, and members, I would like a green vote.
Senator Sharon. Roll call requested.
Thank you, Madam President. And this is one of a number of amendments that have been made to the e-cigarette bill as we move through 5 committees. And in each of those committees, these amendments were rejected. And they were rejected on a number of reasons, one of which is that it is not reasonable to ask that e-cigarette and the consequences of the vapor of e-cigarettes and the freedom to breathe benefits only be experienced by those who are in these public buildings, that the benefits of that, if it makes sense to do it in these public buildings, and you want to protect people from these vapors in those buildings, that they should be protected in all buildings. And they need to be protected because this is an unregulated industry, because we really do not have conclusive evidence yet as to the extent of the risk, not only to the users of e-cigarettes, but to those that are subjected to inhaling the exhaled chemicals that are in the e-cigarette. We have a variety of studies that indicate a growing body of evidence that there is concern for us as it relates to the impact of the contents of e-cigarettes on their users. We are less able to determine what the consequences of that are on the general public because of the uniqueness of each of the various products, our inability to regulate them because we do not know and cannot compare the contents in the various forms of this product. But what we do know is that while we support the e-cigarette user, if they are an adult, in having to take on that risk should they think they may be able to quit smoking because they use cigarettes, or if they want to continue their nicotine addiction by using e-cigarettes, and the risks associated with doing that with electronic cigarettes is solely on the person who's utilizing that product, that device. But to not to ask the general public to share in the risks that's associated with inhaling the chemicals that are in this product and in this vapor along with the user. One of the things I'd like to make note of right now in relationship to this, even though the amendment speaks specifically to disallowing it in certain places but not all places, as is the case in Article 1, I just want to reaffirm that it's important to protect the general public from the risks associated with inhaling these chemicals in all places, and to not rise and not cause one place to be treated as it needs or should have this protection when another does not.
Senator, who stood up first?
I'm sure she did.
Senator Rosen.
Thank you, Madam President. I rise against this amendment. And members, I was on the conference committee for the Freedom to Breathe with Senator Sharon way back. That was a gutsy move back then for a Republican. And it was the best vote, the best move I ever made, because we can definitely measure the benefits of the Freedom to Breathe Act. And it is all about prevention. Now, there is this argument that we don't know what the vapors do with these cigarettes. We have no idea what's in them, if there's a harm to the public. That is the very reason why we should not allow that in public until we do know more. But something that goes beyond and dovetails with the Freedom to Breathe Act and our message about cigarettes is, what are we sending to our children? What kind of message are we sending to our children? And Senator Eaton brought this up in Health and Human Services Policy Division. And I thought this was probably one of the best arguments against allowing e-cigarettes in public. It's okay to smoke e-cigarettes, but it's not okay to smoke cigarettes. It's okay to smoke cigars, but it's not okay to smoke cigarettes. I mean, seriously, members, we should get the message straight and tell the kids that smoking is is not right, it's not good for you, I don't care in what form it is, because there are damaging effects ongoing and it's unnecessary. So, Madam President, members, I believe until we have more information, and we know these vapors don't do anything to the general public, we should not be allowing this in the general public, and we should do a service for our children and say, no smoking is right at all. In the public, you can do whatever you want in private, but in the public, let's set a strong message to our children.
Senator Hall.
Thank you, Madam President. I think this amendment is really good, and let me tell you why. We do have a freedom to breathe good air, and as much as I don't like cigarettes, I appreciate the fact that I can go into a restaurant and not walk out of there with smoke all over me and the smell all over me. But, you know, let me say private businesses also have freedoms, and part of their freedoms is to regulate what they want within their businesses and do that unless it's unsafe. And then the government comes in and says, you're putting the public at risk here. And as the author of the bill herself said, there is no conclusive evidence that this in any way brings harm. And so freedom should be our default. Let me say that again, members. Freedom should be our default. Unless there's proof of harm, freedom should be our default. And to not do that takes us down a trail that is really scary, that if we think something could be, maybe not now, but could be harmful in the future, we need to regulate it, we need to stop it, we need to eliminate it. That's a scary place to be. So this is really a good compromise, and I would accept this as a compromise and vote for it. Thank you, members.
Senator Nelson.
Thank you, Madam President. Members, I rise to speak against the motion before us, Amendment A15. I was not here when the Freedom to Breathe Act was passed, but we have seen great changes in Minnesota's society and culture and social mores. And while I believe that, in a sense, it may be premature to put this under the Freedom to Breathe Act, because we are waiting for that scientific data about what's exactly in those vapors. Yet, on the other hand, we know that smoking tobacco of any in public places, smoking it is dangerous. And what we do know is we have seen a change in Minnesota values and in Minnesota culture. It takes decades to change social mores. And I can remember growing up in the 60s when smoking was part of being successful. It was part of every movie, every successful business person seemed to be smoking. It was part of our daily lives. And we have moved very, very far from that. And it is so hard to change those social mores, and especially in a relatively short time, that I cannot support going back to a time where kids grow up seeing people smoke in public places. And so I speak against this amendment because of the great change and the great accomplishment that has already taken place in Minnesota regarding the acceptance of smoking in public places. And furthermore, I visited with some restaurant owners, some who were the most loudly opposed to the Freedom to Breathe Act when it was passed. And I wanted to see what their thoughts were about e-cigs, because I was kind of expecting them to say that they did not want e-cigs banned in their restaurants. However, I was very surprised. These owners told me that they don't want to be in the position of being in their restaurants and trying to determine who might be smoking a tobacco cigarette and who might be smoking an e-cigarette. And so that also spoke very loudly to me that the very opponents of freedom to breathe, in this case, the folks that I spoke with, support putting e-cigs under freedom to breathe. So I believe that we should err on the side of caution. We should not go back and have children in situations where smoking is a part of public life anymore. Therefore, I would encourage a no vote on this amendment.
Senator Sharon.
Thank you very much. I appreciate this continuing conversation. I would like to have an opportunity to respond to some issues that may raise concern. I'd like to earn the votes of those that have some objections. First of all, I would want to remind the body that if one of the things you're thinking about is because you can't smell the vapor, that you're not impacted by the substances that are in the vapor. It was not the smell of tobacco that made the justification for freedom to breathe. It was because of the risks related to the inhaling of chemicals that cannot be seen nor smelled in tobacco, and that's the case in e-cigarettes as well. It was also described in some of the objections. Shouldn't we consider it the business's responsibility to determine the boundaries of their own establishment. Well, we have longed, especially in establishments that are licensed facilities, licensed to provide food, licensed to sell alcohol, to follow certain regulations and requirements. It is not simply the freedom to do whatever we want to do, whenever we want to do it, when you have the right to serve the public. And we need to ask, as Senator Nelson so appropriately pointed out, whether or not the business owners really want to get into the middle of a disagreement between somebody who's vaping and somebody who wishes they weren't. In order to further support the position that businesses are taking, besides an earlier inventory of Minneapolis retail establishments, bars, and restaurants that really hoped the state would take this off of their shoulders and establish the same regulations in the Freedom to Breathe Act, we have, and I think it is in front of you as well, a letter from Kevin Lewis, who's the executive director of BOMA, which is a 110-year-old trade organization with 600 members representing over 60 million square feet of office space with thousands of tenant companies that occupy that space in respective buildings. And what they have asked for, they strongly support the proposed legislation that treats these devices under the guidance of the Clean Indoor Air Act. And in addition, you have a list, you may not have recognized it because the front of the handout has Freedom to Breathe written on it in a blue circle, but within the context of those handouts, you will discover another letter. And in that letter, there's so many signatures, I hope you'll pay attention to them, of the chief executive officers of a number of health agencies throughout the state of Minnesota that support. These are the executive directors, and I'll just give you an idea, not of the names, but of some of the organizations. Alina Health, American Cancer Society, the Heart Association, Blue Cross Blue Shield of Minnesota, Centra Health, Clay County Public Health, American Academy of Pediatrics, American College of Physicians, the Minnesota chapter, the Association for Non-Smokers, Children's Hospitals and Clinics of Minnesota. That's just some that are listed on this letter, urging us as chief executive officers, and also from Kevin Lewis as representing many, many square feet of privately held business and office space that would want us to step forward as we did with tobacco and establish this boundary. Also, I heard that there's no conclusive data about the substances in e-cigarettes being a health hazard. That's only a partial statement. I also said that there's a significant growth of data indicating that there is growing risk and concern not only to the users but to those who inhale the vapor. And I have a list of the number of articles. One is recently, as March 6th that came out, April 15th that came out in the New York Times, talking about nicotine-laced vapor that promoted the development of cancer in certain type of human cells, in the same way that tobacco does. And then in another New York Times article, March 6th, talked about middle and high school students using e-cigarettes being more likely to become real smokers and less likely to quit smoking. We know that young people who are exposed to nicotine addiction products, whether it's smoke, tobacco, or electronic cigarettes, at the time that they're developing their brain synapses, that they're highly likely to continue with their addiction of nicotine. And that is precisely the value of marketing these products to young people. If you can catch a person young during early brain development to become addicted to nicotine, then they're more likely not only to continue to use e-cigarettes, but likely to smoke, or likely to use other flavored or specialized products that have nicotine in them. So not only is the smell issue irrelevant because it's not about the smell, it's about the contents. Businesses and CEOs are asking us to step forward and address this issue. Businesses understand that their rights to run their business are not infinite, that they have limitations placed on them, especially as it relates to public health. There is a growing body of evidence that there is risk and that the public should not have to share that risk with them. And I appreciate the opportunity to respond to those concerns as people raise them.
Senator Nenau.
Madam President, this is a completely, absolutely reasonable amendment. You know, if the state of Minnesota wants to take a position that we don't want to allow electronic cigarette vaping, it's not smoking, let's be clear, it is not smoking. If we want to prohibit that in our public buildings, that's up to us. But who are we to tell Joe's on Main that they can't let somebody have an electronic cigarette sitting in the bar, that they can't vape? Let me tell you, members, if you've talked to your bar and restaurant owners after we had the smoking ban passed, they got hit. And particularly for bars, because people would go outside in January to go get their nicotine fix. Now, whether you hate smoking or love smoking or whatever, the reality is it's legal and people are addicted to nicotine. And they'll go outside to get their nic fix. And when it's 20 below, they might just head to the car and say, you know what, I'm going to go home. And the bar loses out on that extra order of French fries or another Miller Lite sold or whatever the case might be, and they took a hit. Electronic cigarettes, at least, and this is the speech I gave in committee, at least with smoking, you can argue that there is a demonstrable secondary impact, that secondhand smoke hurts other people. There is nothing anybody can point to that says, look, this electronic cigarette vapor hurts the guy sitting 2 booths down. There is nothing that you can point to that says that. In fact, the author of this particular bill in the Health Committee said we need to protect people against the unknown risks. Now think about that. We're going to protect you against unknown risks. Where does that end? What are the unknown risks of Cheetos? What are the unknown risks of fried red meat? What are the unknown risks of tap water in St. Paul? Let me read to you. The heavy metals measured in St. Paul: cadmium, lead, hexavalent chromium. The poisons: ammonia, nitrogen, chlorine, fluoride. What are the unknown risks of allowing a restaurant to serve those poisons in their water, to boil it into the air? Second-hand hexavalent chromium. There's no end to this logic. If you can point to a study that says this absolutely hurts other people, then we can have an argument. Then we can talk about whether it's a good idea, bad idea, based on the science. But what we're doing here, in my opinion, is simply political correctness because people don't like smoking, and an e-cigarette looks like you're smoking. Before government gets in, steps into a private business or a private life and starts to regulate, we need to demonstrate that there's a compelling public interest, and we need to determine that that compelling public interest overrides the rights of the individual and the rights of the business. That absolutely is not the case here. Please vote for this amendment.
Senator Peterson.
Thank you, Madam President. Members, Senator Nenau pointed out a number of great points relating to this arbitrary ban. Members, it's already been laid out. There's no evidence to show that e-cigarettes are harmful. But there's a point that hasn't really been elaborated on here, which is this is exactly what happens when government decides that it can intercede in the decisions made between voluntary decisions made between its consumers and the property owner. Property owners cannot decide to allow a product, and now with no basis, they can decide that unknown risk, which is a made-up, I mean, I don't even know, that's a made-up concept. There's always, everything unknown is always unknown, and positing that there might be a risk associated with something unknown is sort of a never-ending loop of cognitive dissonance. So members, but the underlying problem here again is just the simple fact that entities, private entities, cannot agree with their own customers to have an environment that allows e-cigarettes or not. In particular, in this basis, without any scientific rationale behind it, members ought to be offended by that. They ought to support the Senator Gazelka amendment.
Senator Jensen.
Thank you, Madam President. I stand opposed to this amendment. I'm listening to the conversation and I hear things like unknown risks, proof of harm. Why do we allow it? Why should we wait? Let them do it now. When I heard this bill in the Commerce Committee as a member of the Commerce Committee, the thing that I kept coming back to over and over again is if there is no harm, if there's no proof of harm, and there's no unknown, if this is only about unknown risks, why do we have Article 2 in the bill? Why do we refuse that youth should be able to do this? That is all the proof that you need. That obviously there is an objection to that. I haven't heard any objection to that through the conversation, through the committee process. I asked over and over again to the people in the committee that were testifying, why do we not allow youth to do this? They could not answer why we don't allow youth to vape. There's an addictive chemical involved in vaping, and we don't want our youth to do it. I don't want our youth to do it. I know the Freedom to Breathe Act was before I came to the legislature, but the benefits, what we had to wait for, proof of harm, how many people were suffering of that proof of harm? I'm not willing to wait for proof of harm on something. Let's wait until there is some scientific that says that it's okay. But I'm not even willing to go with that because there must be something or we would not refuse it to our kids. And when we do this in public and only restrict this to government buildings, we are sending the message that even though we don't want you to do it, it's okay to do it, and once you become to the legal age, then go ahead and do it. Please vote this down. We need to have the ability to say no, that it's not okay, even if you're young, and when you reach a certain age, it's okay to do.
Senator Gazelka.
Thank you, Madam President. And Senator Jensen and I agree on most things in the Commerce Committee, but this is one we disagree. I don't want youth to do it either, but I want responsible adults to be able to make that decision for themselves and not our government choosing that for them. You know, within the last 2 weeks, we've been contemplating whether we should legalize marijuana for medicinal purposes or even, frankly, some for recreational purposes, but somehow this is in a different category. We probably shouldn't have called it e-cigs because it is not cigarettes. It's very, very much different from that. You know, and the fact is, if every tobacco user or cigarette user was influenced by people using e-cigs and switched to e-cigs, I've got to believe they would be better off, and so would we. There's a number, and I want to point out too, this is hopefully the last time I stand up on this, but the U.S. Food and Drug Administration has drafted proposed regulations on e-cigarettes. They're currently being reviewed by the White House Office of Management and Budget. So they are taking a good look at this. And while the FDA recognizes that e-cigs are a different kind of product, the agency also wants to get the science on e-cigs so they get it right the first time. And so that's all we're asking here. This bill or this amendment for clarity, Madam President, members, it's still, if this amendment is adopted, it still prohibits the sale of e-cigs and vaping products to youth. That's still in the bill. It limits access to minors of e-cigs and vaping products. It limits the use of vaping products in schools. It clarifies regulatory requirements for stores and retail locations in municipalities. It subjects stores selling e-cigarettes and vaping products to underage stings and law enforcement. So all of that is still in the bill. And the amendment still lets us to decide here what we want to do in government buildings. We're simply saying, without the data, without the science, we should let the private businesses decide what they want to do.
Senator Tomassoni.
Thank you, Madam President. This is an amendment that I'm going to support, even though I would like to see all of Section 1 deleted. And so this is a compromise amendment. And it's a compromise, maybe it's based on us not knowing information on either side, whether it's right or wrong. And so maybe it's good to just compromise on this and start out in one spot and eliminate it from government buildings. But members, here we are once again trying to make a decision on something that we don't have any information on. It's like, well, okay, somebody thinks this might be bad, so let's make sure nobody gets their hands on it. Well, there's a real lot of people who are getting their hands on these things and they're actually quitting smoking. And they're quitting smoking because it's a good substitute for a cigarette and it doesn't cause the harm that the cigarette causes because it has very, very low chemicals in it, and it makes the cigarette smoker not want to smoke anymore. It's a healthy thing. It's actually a healthy thing. It stops people from smoking. And we quite frankly pass laws all the time about kids and what they can and can't do. And when they become an adult, then they can start doing them again. So that's just a natural thing for this bill to have in it. But members, we're sitting here trying to make a decision on something that we don't even have very good information about, and trying to tell everybody, no, you can't do this in certain places because we think it might be bad. Well, I think it's time that we just take this amendment, say it's a good compromise amendment. It says something about government buildings and government places so that if anybody's worried about going into one of our offices and somebody having an e-cigarette, they don't have to worry about it. But quite frankly, members, this is not something that we should be imposing on under the Clean Air Act, and this amendment should be passed as opposed to subjecting everybody to it.
Senator Sharon. I'm sorry, Senator Peterson.
Thank you, Madam President. Just in the interest of not letting my friend Senator Jensen's question go unanswered as to why we make the distinction between kids and adults, the answer to the question is, Senator Jensen, is we're talking about who the primary, in your situation, you're talking about who the primary consumer is. We don't allow kids to be the primary consumer of nicotine, but we do allow, even after the position that you are defending becomes law, we still allow children to be subject to secondhand e-vapor. We're not banning that outright. So the distinction is, Senator Jensen, that we're talking that you're talking about the primary consumer of the product. We don't allow children to be the primary consumer of the nicotine. And that's the difference between it. What this bill is seeking to do is to regulate the secondary consumption of e-cig vapor. It's an entirely different subject. So that's the answer. And I would imagine, and Senator Tomassoni is absolutely right about the fact that individuals are quitting smoking. But let's just pause it for a second, that nobody really knows and the data doesn't show that. Well, then that position is on equal footing with the supposed unknown risks of secondhand e-cig vapor. So at best, it's a wash.
Okay, we have Eaton, Sharon, Latz. Senator Eaton.
Thank you, Madam Chair. I just wanted to reiterate points made by Senator Rosen and Nelson earlier, that e-cigarettes do have the potential for renormalizing smoking. They make it look like an acceptable behavior. It took us years to get the numbers to drop in the middle school and high schools, kids who are starting smoking. Already, it's gone from 3 to 7% in those using the e-cigarettes. We do have some studies that show harmful components in the vapor. And many of the e-cigarettes come in flavors. Kids are putting marijuana in them. They are being used for many things, and you really have trouble sometimes smelling the vapor as to what is in them. They're just a really bad idea.
Senator Sharon.
Thank you. I'm reminding myself as we're talking here that the amendment is restricting the use of e-cigarettes in government buildings. So my fundamental challenge in terms of supporting this amendment is that I cannot make sense in my mind as to why it makes sense to prohibit their use of e-cigarettes and to protect the public from the secondary vapor impacts of unknown chemical emissions in government buildings and not have it be equally important to protect the general public in all other public spaces. So the underlying principle that all public spaces need to be held under the Freedom to Breathe Act holds true, and in and of itself is reason enough to vote against this amendment. But also, I want to reiterate, even though the opponents of this might say there is no evidence of harm, there certainly is no evidence of safety. And there is also a growing body of evidence increasing our knowledge as to the risks of this product, not only to the user, but to those who would inhale those exhaled chemicals. As to the issue that has been raised, I would hope those who think about why would we preempt the progression of the use of this product if we don't have firmly rooted research that says it's a problem. There certainly is a precedence for this, especially as it relates to mood-altering substances or chemicals, which nicotine is one of the most toxic chemicals and highly addictive substances. We preempt the sale and the production and the use of many mood-altering chemicals, requiring those who produce the products to demonstrate that the risks are acceptable to the public before they're allowed to sell it in the common market. So the precedence for the state, for the federal government and the state taking its position of protecting the public's health is well established, especially as it relates to the emission of mood-altering chemicals. And I want to remind the group that there's nothing in this bill that stops adults from using e-cigarettes. There is nothing in this bill that prohibits someone who wants to try to quit smoking from using e-cigarettes to do that. There's nothing in this bill that prohibits a person who wants to continue a nicotine habit from continuing that habit, from increasing that habit, from using a variety of products that have nicotine in them, should they want to. There's nothing in this bill that stops that for adults. Those risks that are unknown to them are theirs to take because they are adults. What this bill does is sets a limit on where that risk can be taken and sets a limit on the request by the e-cigarette users and sellers to ask the general public to share that risk with them by asking them in enclosed public spaces to inhale their exhaled chemicals. So I rise again. I know that the focus of this amendment is on allowing e-cigs in bars and restaurants while prohibiting it in government buildings. But I rise again, and I think that the vote will indicate whether or not this body supports it.
Senator Latz.
Madam President and members, 79% of Minnesotans, according to a poll taken in January of this year, support the Freedom to Breathe Act's provisions that prohibit smoking of regular cigarettes in bars and restaurants and other enclosed spaces where the public is invited to be patrons. 79%. It's 4 out of every 5 persons in Minnesota. 76% support Section 1 in this bill. The polling was done just 3 months ago. 76%. 3 out of 4 Minnesotans support Section 1 of this bill. So whether you live in Anoka County or you live in northern Minnesota or in southwestern Minnesota, your constituents overwhelmingly support the provision in this bill as it stands, applying the restrictions to use of e-cigarettes in these public places like restaurants and bars. And members, I say this across the state, it's not all a metro number for those of you who think it might be. In 2007, when we passed the extension of the Freedom to Breathe Act to regular cigarettes, polling was done, I remember the numbers, polling was done looking at sections across the state, and there was not one region of the state that had a lower level of support than the upper 50 percentile at the time before the measure was passed. So it doesn't matter what area you represent, members, your constituents overwhelmingly support the provision that's currently in the bill. And the numbers have gone up every year since 2007 for those who support the Freedom to Breathe Act provisions applying to regular cigarettes, and that increase in number is reflected in the polling data specifically to e-cigarettes. Now, to the question, do we know whether or not this is healthy? There's already been some reference to this here. Members, a couple of days ago, in the New York Times, there was a report about a study in the journal Nicotine and Tobacco Research. The study was to be published this month says the high-power e-cigarettes known as tank systems produce formaldehyde. Formaldehyde, a preservative for dead bodies. A known carcinogen produced by e-cigarettes, along with the nicotine-laced vapor that their users inhale. And the toxin is formed when liquid nicotine and other e-cigarette ingredients are subjected to the high temperatures in the e-cigarette. It causes a chemical reaction. A byproduct is formaldehyde. And there's a second study being prepared for publication in the same journal, peer-reviewed research, that reaches the same conclusion. So while we don't have a vast body of academic and research studies yet, the early data is resulting in exactly the kind of concerns that would be addressed by the bill that you have before us and that would be undermined by the amendment that is proposed. Now, lest we get too far into the debate of whether or not this is smoking or not smoking, members, you can look at the handout that I sent out today on the floor and also that Senator Sharon sent out with some ads. So here's an ad for e-cigarettes. I received it in my law office email for online sales of e-cigarettes. The product is called Smoke Star. Members, the industry is labeling it themselves as smoking, and they're calling it e-cigarette. Okay, that's not a label that advocates for public health are putting on it. That's what the industry is calling it, because they want the users to believe and feel like they are actually smoking. In fact, that's the headline in this ad. Looks, feels, and tastes like a real cigarette. And is that the message? That's the message, members. The other ad here for blue electronic cigarettes, the title in the ad is Smoke in Style. Smoke in Style. And blue, by the way, is owned by Lorillard, one of the largest traditional cigarette manufacturers in the world. Members, this bill doesn't say that responsible adults can't decide for themselves what risk to take, but they shouldn't be able to force the rest of us to take that risk right along with them. And in particular, when we get into restaurants, bars, other public enclosed spaces where there are employees, people that are working, that are earning a living to pay for their rent and to pay for their food and to pay for their children and their spouses, they don't have the choice to walk out of the establishment that even other patrons have. They are essentially forced to choose between their livelihood and their health if their employer decides that they're going to allow e-cigarettes with an unknown but increasingly known risk in that establishment. So even if you believe that other patrons can make that choice, walk out the door if they wish to, the employees don't have that choice. Members, there's been an argument made here that we shouldn't be regulating private business like this. But look all around you. We are regulating private business already in myriads of ways. So, for example, in restaurants, I'll just give you 2 examples. Health regulations have a minimum temperature for the water that is used to wash the dishes. That's a regulation. That's the government saying, for the health of the patrons in that restaurant, when you wash your dishes, the water has to be at least a high enough temperature. And the electrical outlets in that building have to be a certain number of inches above the floor to protect against fire hazards and other such hazards. Another regulation of private business to protect the health of the patrons and the employees of that business. So we long ago crossed the threshold of whether or not we are going to regulate these kinds of private businesses. The question is, what kinds of regulations are appropriate and what kinds aren't? And that leads me to my final point, members. Local governments are already taking the initiative and regulating local businesses with regard to e-cigarettes. They're banning the use of e-cigarettes in public spaces in exactly the same manner that the underlying bill here proposes to do. What that does, as individual local communities introduce and pass these regulations, is it creates a patchwork of regulations across the state, where on one side of a city's border or one side of the street there are certain regulations, on the other side of the street there may be other regulations. So it ends up leaving businesses with an unlevel playing field. Members, I would submit to you that the businesses are better off with a level playing field. If their competitor next door or across the street or down the block is going to be subject to the restrictions or is not going to be subject to the restrictions, they don't want it. If they're going to be subject to the restrictions, they want their competitors to have the same regulatory framework so there's no unlevel or unfair competition going on. So members, it's entirely appropriate for the state to step in at this point, just like the state stepped in with regard to regular cigarettes in 2007. Make it a level playing field, level competition for all businesses. They'll all know what the rules are. And we can make sure that we know that other patrons, other members of the public are not being forced to accept the risk that individual patrons may want to take for themselves. You know, if you drink water that has whatever's in it, it's only your body that gets affected. It's not your neighbor's body, your seatmate's body. And so many of those other risks you choose to take upon yourself, it doesn't spill over to everyone else around you. With e-cigarettes, whatever that risk is, it spills over to everyone around you. This bill would prevent that. The amendment would unfairly and unduly limit that. And as Senator Sharon so eloquently stated, I don't know that the health or the life of people who come to public buildings is any more valuable than the health or the life of people who go to private businesses that hold themselves out to the public to come in as patrons. Health and life is the same for everyone, no matter what establishment you go to. You ought to be entitled to the same protections for your health when you go there.
Senator Peterson, then final comments by Senator Gazalka.
Thank you, Madam President. And members, I promise you I will not offer this amendment now that I'm making another comment on this bill.
We already have an amendment before us. Senator Peterson, the A15.
I understand that. I said I'm not offering the amendment. It was a joke, Madam President. Okay. I'm sparing the body further debate on another amendment in order to make a point on this one. Well, you heard it there, members. You know, because we regulate, we might as well all just lay down right now and obey to every other regulation that comes down the pike, because heck, we've done it before, and we happen to regulate other stuff, so we might as well regulate everything. The start of the comments from Senator Latz was related to polling. 79%, he said, support the Freedom to Breathe Act, and 76% don't happen to support Section 1 of this bill. Well, my point is, members, so what? Are we all subject to majority rule on every decision? Senator Latz knows very well that's not true. Many atrocities and injustices in this country have been laid upon minorities. Not to compare this with that, but I'm just suggesting that that is not the basis by which we govern, nor should it be. We are all minorities of one, with our own unique set of interests, and we ought not govern under the precepts of mob rule. Members, the idea that just simply because a majority of people believe something, that we should just sacrifice the notion of private property out of hand and not even question it, with the idea, under the idea that there may or may not be a risk, really, it philosophically knows no bounds, and I appreciate the member's indulgence.
Senator Gazelka.
Final comments, Madam President. I did want to comment because there's a couple of surveys that were cited. I know there's another survey that said, within the last few months, that said 2/3 of those polled do not mind sitting next to somebody that is vaping. It's not the same as smoking a cigarette. When we talk about chemicals that are in vaping, you know, there's a lot of trace chemicals that that influence, that we take in, that really are not harmful at trace levels. Even that for the formaldehyde comment was produced in an extreme manner for that to be part of it. But you know, all of that still comes back to my original, or one of my original arguments, that let's let the FDA do their work. And what amazes me in this situation is just not even a week or two ago, when I had an amendment that said, let's wait for medical marijuana, let's wait to make sure the FDA says it's okay before we let people do it. Now we're saying we don't want to have the FDA involved, and we're going to stop people from doing it. So you can't have it both ways. So members, I recommend a green vote on this.
Seeing no further discussion, the Secretary will take the roll on the A15 amendment. Senate is under call. All members having voted, the Secretary will close the roll. There being 28 ayes and 35 nays, the motion does not prevail. The amendment is not passed.